Hi, this is Dr. Kreshe. Welcome to week 14. I know we're not meeting in person this week, but we will be reviewing disability awareness and cultural competence. As you can see, this presentation is from the Federation College. The goal of this presentation is to give you a better understanding of the different types of disabilities, how people have similarities despite disabilities, and one of the ways that you can think about disabilities is to think more about individuals as abled. What can they do? How does one disability or challenge make you stronger in other areas? We'll also be talking about the ways in which we can assist individuals with disabilities. So, what is a disability? Disability, as you can see, has multiple definitions, and it includes medical, psychiatric, injuries, learning disabilities, or any of the above. It's important to note that some disabilities are invisible, as you can see here, so that it's not clearly obvious to everyone that the person has some challenges. Here's some information on the specific disabilities and how common they are. Now, this is pretty old information from the US Census, and I put a link to the CDC so you could get more recent stats. And we should also note that although in 2010 the incidence of Alzheimer's, dementia, and senility was only 2.4 million, that number is quickly growing as we're hitting the silver tsunami, and we have many individuals who are elderly and are having these issues. More specifically, what are learning disabilities? And you can see here, I think one of the most important ones is that there is a difference between the potential for achievement and what's actually happening. The issue is that, of course, with proper diagnosis and support, individuals who struggle with learning disabilities can be very successful. So the impact of disability really varies. As you can see here, it's important to note that financial impact, self-esteem, housing can all be issues that affect the individual. How behavior can be interpreted when a person is struggling and not willing to disclose, you can see here they can come across in very negative ways. Your text defines disability in the following way, that it's a physical or mental impairment that limits the individual in one or more areas of life. Now, what your book also notes is the high rate of individuals with disabilities who are empowered. And you can see it's pretty substantial to have that number in a population. In terms of thinking about cultural competence with individuals who are disabled, you just have to remember that disability isn't the only thing that defines them, that they are part of other cultures, and to start thinking about disability in a more positive way, and to really learn to respect individuals for who they are, irrespective of their disability. Your book makes note of 5 dimensions, life dimensions, which includes time, activity, relational, human nature, and basic humanity, as ways to think about intersections with individuals who suffer from disabilities and culture. We also want to think about the historical oppression of disabled individuals, which is actually quite significant, including euthanasia and more recently the extermination of disabled individuals in Nazi Germany. In terms of the rights of the disabled, we had some significant legislation in 1990 that became a civil rights issue, and of course the push is really to emphasize strengths rather than challenges. And there's been a whole revolution in the mental health arena where we're talking about wellness and recovery and letting people define their own wellness and recovery, which means that individuals with disabilities have a right to really make their choices, decide what recovery looks like for them from mental health, from substance use, and our role as human service workers is to support them. So cultural awareness, disability is not unnatural. It's simply a part of nature and a part of who we are. You have to remember that for looking at disability historically from the medical model, where we've seen disability as a deficiency, and that defining people in that way limits their capacity. And there are so many individuals with disabilities that have achieved so much that it's quite fascinating. And if you want to think of somebody, think of Stephen Hawking, so one of the leading astrophysicists of our time. So in terms of knowledge, really understanding the negative stereotypes and views and avoiding those pitfalls. What to do when you're meeting someone with a disability. Most of you have met people with disabilities. There's really, you treat them the same way you do everyone else. If there's visible impairment, then yes, you need to be more patient and try to accommodate. You need to, as far as skills and working with people who are disabled from a human services standpoint, you need to complete assessments and evaluation, learn about situations, and assess the biopsychosocial impact of their challenges. So they're not disabled. Don't think about them that way. Think about how they are abled. What are their strengths? In terms of being competent and respectful and engaging in respectful partnerships, be sure that you ask before you assume that people need help. Whatever you do, don't make assumptions. And think about your biases before you speak. Whatever you thought the limitations were, really evaluate that. As far as social and economic justice, just as a reminder, we cannot have social justice unless we have economic justice. So in terms of tackling social justice, we need to look at what are the greatest barriers that individuals with disabilities face. This includes housing, poverty, employment, accommodations, the right to live in the community, not in institutions, the right for self-determination and advocacy. As far as working, you can see the different roles here and how they affect the individual, whether you're a counselor, a teacher, or a social worker, or a human service worker. So in terms of some tips to working with disabled individuals, you want to put the person before the disability. Do not use stigmatizing words like handicapped or and look at the difference in the terminology here, wheelchair user versus confined to a wheelchair. So that puts the person as the agent as opposed to the sufferer from the disability. And that provides an environment of enabling the person to fulfill rather than limiting them by their challenges.